Over the last few episodes, we have discovered how technology competes for our attention and how our brains are wired to seek novelty. And but here is what many people make a mistake. They assume that every situation is caused by the smartphone. But sometimes that's true. But sometimes the poor concentration isn't the problem. It is the first symptom of something else. Only the smartphone are not responsible. Suppose imagine a patient comes to a hospital with a fever. The fever isn't the disease, it is the signal. The real cause could be pneumonia, malaria, or COVID-19. So similarly, or dozens of it can be of the dozens of other condition can fever cause fever. So poor attention is similar. It can be a first sign that the something deeper is affecting the brain, and even an underlying medical condition can be there which causes the poor attention. So today we will look at the attention the way doctors look the patient, and instead of asking why can't I focus, we will ask what is preventing my brain from focusing. So let's explore the some of the most common causes of medical and psychological causes of poor attention. Here comes the number one big reason, that is the sleep. Sleep is the foundation of attention. If I had to choose one factor that affects attention the most, it would probably be sleep. Many people proudly say that I only sleep for 5 hours, but neuroscience says something different. The sleep isn't the passive rest. Sleep is an active process during which our brain consolidates our memories. It clears the metabolic waste, and our brain helps to restore the cognitive function in the sleep. Even after one night of inadequate sleep, many people experience the slower thinking, reduced attention, and more distractibility, and the poor working memory and the slower reaction time. And they also have the more impulsive decision. And think of your own experience after an one night stay where you haven't slept. Does studying become easier or harder next day? So you know the answer. Most people already know the answer. And sleep deprivation doesn't just make you feel tired; it makes your sustained attention much more difficult. So that's why the adequate sleep is very important. And next important factor we have is the chronic stress. Our brain evolved to respond to the danger. When you are faced an emergency, your brain shifts into the survival mode. Our heart rate increases, the stress hormone rises, and attention narrows towards the immediate threat. That's helpful if you are escaping a tiger. But modern stress is different. The deadline, the financial worries, the relationship conflict, the exam pressure, the hospital workload, or even any job you do, any job pressure. This stressor may last for a month, and when stress becomes chronic, it can make it much harder to concentrate, learn, and think clearly. So instead of focusing on your work, your brain keeps returning to your source of worry, and that is the important source of poor attention. And next we have is anxiety. Many people think that anxiety means feeling nervous, but anxiety also affects the attention. Imagine trying to read a textbook while another uh, you are trying to read a textbook, and your another part of your mind keep asking, "What if I fail? What if something goes wrong? What if people judge me?" Their attention is limited during those conditions. And when anxious thought occupy a part of our brain capacity, there is less attention remains for our learning. And people often describe this as, I read the page, but nothing goes inside the brain. So anxiety could be a contributing factor for your poor attention. And next, we have the depression. Depression is far more than sadness. It is one of the common symptom. It's one of the common symptom is difficulty in concentrating. People often experience a mental slowing, reduced motivation, and difficulty in making decisions. And trouble, they have trouble remembering the information. They have the poor sustained attention, and sometimes patients worry that they are becoming less intelligent. But in reality, their cognitive performance is being affected by the depression. As the mood improves, the attention often improves as well. So your mental health condition has a very important role in attention. Next we have is ADHD. So now let's talk about ADHD, which is one of the most misunderstood condition on the internet. The ADHD doesn't simply mean someone can't pay attention. In fact, many people with ADHD can focus intensely on activities that they find engaging, and this is also sometimes called as hyperfocus. But the challenge is regulating attention consistently. The tasks that are repetitive, delayed in reward, or less stimulating may be much harder to sustain. And not everyone who struggle with focus has the ADHD, and not every distracted person need medication. But if someone has experienced the significant difficulties with attention since childhood, across the multiple setting with meaningful impairment and proper assessment, by a qualified psychologist or psychiatrist is necessary, and self-diagnosis from social media can be misleading. So we have the next is information overload. You think about your brain like a computer. If you open 100 program at once, the performance of the computer slows. Similarly, our brains have limits too. Every article, every podcast, and every small notification, every email, every unfinished task consumes the mental resources. Sometimes we don't need more information. Sometimes we need more time to process what we already know. So more information is not always healthy. They reduce your attention. And next we have is physical health. The brain depends on the body. If your physical health suffer, your attention often suffers too, because brain suffer. And some medical condition that can contribute to our poor concentration in they include like various conditions like iron deficiency anemia, the vitamin B12 deficiency, thyroid disorder, and poorly controlled diabetes, chronic pain, certain medication, substance abuse. And these various conditions can cause attention, and but they don't explain every case of poor attention, but they are important possibility, if especially if the concentration problem are new or accompanied with other symptoms. These conditions should be ruled out, and it should be done by healthcare personnel. And next is exercise. You don't need to become the marathon runner, or but regular physical activity supports the brain health. The exercise has been associated with the improvement in attention, executive function, mood, and overall cognitive performance. And one reason maybe that it increases the blood flow to the brain, and it releases the various growth factor involved in brain plasticity, that is neuroplasticity, and even daily work can make the meaningful difference. Exercise is very important for your attention. Next, we have is nutrition. People often ask, is there any special food that improve focus? The honest answer is there is no magic food, but the brain works best when the overall nutrition support it. So staying hydrated, eating enough protein, consuming fruit and vegetables, and avoiding large swing in the blood sugar can all contribute to our better cognitive function. And healthy eating is not a shortcut to the perfect attention, but the poor nutrition can certainly make concentration hard. Here is the biggest mistake many people make. They notice the poor attention and immediately blame themselves. I'm lazy, I'm not disciplined, I'm just bad at focusing. And sometimes that's the wrong conclusion. Your brain may simply be telling you, I'm exhausted, I'm overwhelmed, I'm anxious, I'm depressed, and I'm sleep deprived, and something need attention. And treating the symptom without addressing the underlying doesn't really work. And attention is like a check engine light. Imagine driving a car and suddenly the check engine light turns on. You could cover it with a tape, but the problem would still exist. The poor attention is similar. Instead of asking, how do I force myself to focus, it can be more helpful to ask that, why is my brain struggling to focus in the first place? And that single question often leads to the better solution. Now we have seen why attention declines. Understanding the causes of poor attention is important, but understanding alone doesn't change our brain. So the real question is, can our attention actually be trained? Can it be our attention can we regain back? Here is the exciting part. The brain is adaptable, which means that attention can be trained. So what actually works? Not the internet myth, not productivity hacks, not a miracle supplement. What does the scientific evidence say about rebuilding attention? That's exactly what we will explore next in our next episode of this Science of Attention. In the final episode of this series on Science of Attention, we will build a practical science-based plan to reclaim our focus one habit at a time. And your attention is one of your greatest asset, and better you protect it, better you can learn, work, and live. So, with this in mind, we will come up in the next video. Till then, Dr. Swarnim signing out. We'll see in the next video, and we will learn the actual evidence based method how to really reclaim our focus and attention.